the principal and the entire Jinsar family to the final day of the National Virtual Short-Term Course on Forensic Nursing organized by Jabalpur Institute of Nursing Sciences and Research, Jabalpur, Madhya Pradesh. Before moving ahead, I would like to briefly reflect on last session. On day 5th, we had a highly informative and insightful session on emerging areas in forensic nursing by Dr. Nanjana Sharma ma'am, Professor cum Principal, Medico-Legal College of Nursing. The session helped us explore the expanding scope of forensic nursing and understand recent advancements and new opportunities in this specialized field. We gained valuable knowledge about the evolving roles of nurses in addressing modern healthcare and legal challenges. Dr. Sharma highlighted the importance of adaptability, innovation, and multidisciplinary collaboration in forensic nursing practice. Overall, it was an enriching and forward-looking session that enhanced our understanding of the future scope of forensic nursing. Moving ahead with today's session, we will be focusing on the topic crime scene management for nurses. This session will provide us with practical knowledge regarding handling crime scenes, preservation of evidences, maintaining chain of custody, and the crucial role of nurses in forensic investigations. So, moving ahead with the program, now I would like to invite Professor Dr. Princy Shaji ma'am, Organizing Chairperson and Principal of Jabalpur Institute of Nursing Sciences and Research, to address the gathering.
Thank you, Professor Aradhana. Esteemed resource person, respected dignitaries, faculty members, and my dear students, a very warm and a graceful good morning to all of you. It gives me an immense pleasure to welcome you all to the final day of the National Virtual Short-Term Course on Forensic Nursing, organized by Jabalpur Institute of Nursing Science and Research. Over the past few days, this academic journey has been truly enriching and insightful. We have explored various important dimensions of forensic nursing, including its introduction, role, violence and abuse, human rights, legal framework, and emerging area. Each session has added valuable knowledge and strengthened our understanding of this specialized field. Today, as we move towards the conclusion session on crime scene management for nurses, will be dealt by an esteemed resource person by Dr. Jaideepa R, Principal, PSD College, Coimbatore. We focus on one of the most practical and critical aspects of the forensic nursing. This topic highlights the significant responsibility of nurses in handling the medico-legal cases, preserving evidence, and contributing effectively to the justice system. I take this opportunity to express my sincere gratitude to our esteemed resource person for sharing their valuable expertise throughout this course. I also appreciate the dedicated efforts of the organizing team and the enthusiastic participation of the all attendees, which has made this program a grand success. Wishing you all very productive and enriching final session. Thank you.
Thank you so much, ma'am. Now, proceeding further, I would like to introduce our esteemed resource person. Professor Beulah Mercy Madam was about to take the session, but because of some unavoidable reason, she is not able to join today. And we are really grateful to Dr. Jaideepa R ma'am for accepting our invitation in a very short notice. And Madam is a principal of PSG College of Nursing, Coimbatore. She is currently working as a principal at PSG College of Nursing, Coimbatore, with over 20 years of experience in nursing education, administration, research, and leadership. She holds a PhD in nursing from Savita University, along with MSc in medical surgical nursing, MBA in Hospital Management, and BSc Nursing, showing her strong academic background. She has a wide range of experience, having worked as nursing tutor, lecturer, assistant professor, vice principal, and principal in reputed institutions across Tamil Nadu, Kerala, and West Bengal. She has contributed to research in many publications in national and international journals. She has presented several research papers at national and international conferences, seminars, and workshops. She is also an author, having written books like Critical Care Nursing and contributing chapters to various academic books. She has guided many PhD postgraduate and undergraduate students and also works as a research guide, co-guide, and examiner for different universities. She has served as a resource person, keynote speaker, chairperson, and moderator in many academic events and faculty development programs. She has organized many conferences, workshops, and training programs showing strong leadership and management skills. She holds various certifications and fellowship in research and academics, including FAI, MAR, fellowship and postdoctoral research work. She is a member of several professional organizations and serves on editorial boards of reputed journals. She has received awards like the Best Principal Award and National Excellence Achiever Award for her valuable contribution to nursing education. And today we are really happy and feel honored to have her with us as our esteemed resource person. And with deep respect, I would like to invite Dr. Jaydeepa R. Ma'am to please take over the session. Thank you.
Thank you very much. Principal Ms. Prince, Dr. Princey and organizing committee. Thanks for giving this opportunity. Though it is a very short notice, but still okay, it's not an issue for me. I have done more than 50 lectures in forensic nursing. I do not know, some of you might have seen on it. Through our association, we work strongly to advocate forensic nursing. I will just share my screen. Is my screen visible? Okay, fine. So thank you very much. Once again, warm good morning to all of you joined through this platform. I really appreciate the organizers' effort in taking steps to disseminate the knowledge of forensic nursing to the audience. Though it is a new topic which is introduced, new subject which is introduced in the nursing curriculum, it's very much interesting. If you really learn in these last few sessions, you must have understood how difficult it is, how different it is, and how important it is to understand forensic nursing. So it is actually needed because nurse always have inquiry mind. You always search for something, you search for findings. Similarly, many principles what we adapt in a day-to-day life of a nursing will very specifically suitable for forensic nursing practices. So I'm asked to teach you regarding crime scene management and nurses' role in crime scene management. This is very important in forensic nursing because nurses play a vital role from the event had occurred until the justice is delivered. So there are multiple stages where we come across with Similarly, we have some role in preventing crimes also. That is also possible. So my interest area is preventive forensics. We are really working more on forensic nursing, and we are doing much projects also in forensic nursing. Maybe at the end, I will just share few of my experience in. A warm greetings from my institution, PSG College of Nursing, one of the pioneer institutions for nursing education in India, a well-reputed institution in Coimbatore, Tamil Nadu. So these are my learning objects. I want you to understand the nurse's responsibilities, how the basic crime scene preservation, what are the principles applied, what nurses can do it, and some legal and ethical frameworks. First, I will let you know what is a crime scene. Yeah. My screen is visible now?
Yes, ma'am.
Okay, fine. So every patient is a potential crime scene, and every nurse is a silent witness to justice. The patient himself is a crime scene only if anybody comes to you with assault or any intentional, unintentional, or intentional injuries. A crime scene may be in any location where a crime has occurred or where evidence related to a crime may be found. Some place where the incident had happened, or some places you find some evidences. So this is what we call it as crime scene. So the types of crime scene includes, it may be a primary crime scene, it may be a secondary crime scene, it may be indoor or outdoor, it may be macroscopic or microscopic. This is a classification of crime scene. So what is a primary crime scene? So that means a primary crime scene is the original location where the crime had occurred. It may be anywhere. So the event had happened in that particular place only. So that is called as primary one. Look at the features of this. Can you mute? It's disturbing.
I request Priyanka Koshti, please mute yourself.
So the key features here is, if you look at the primary crime scene, the evidences are of highest concentration. You will find lots of evidences in that particular place. Initially, you may feel that the evidences are undistributed, scattered here and there. You will find evidences, and this has a direct link with the criminal act. If you really understand easily the scene, so that you can come to a conclusion of the pattern of a crime, how it had happened. For example, a homicide, suicide occurring in a bedroom. So it will have the evidences within that particular boundary only. You can visually see and feel what evidences you can collect, how you have to collect it. Another example is assault at a roadside. Somebody comes, hits somebody at a road. So this is only present in that particular. So what is the nurse's relevance in that particular crime scene? Patients brought from this scene may carry evidences. Sometimes you may not be presenting in that crime scenes. When they come to a hospital, usually they visit casualty. So the patient himself will carry many evidences like blood, fibers, weapon, traces, the pattern of injuries. So all these are evidences. So nurses should understand it. And it is critical to avoid contamination during emergency care. So when a patient is brought to casualty with life-threatening injuries, we try to save the life. So during that process, there are lots of chances for evidence contamination. And secondary crime scene, so that is related location. For example, murder had happened in a house and the dead body is brought to some other place. So this is what a secondary crime scene is, any location other than the primary site where evidence is found. So some murder happened in a house, then that dead body is put in somewhere in a forest. So that becomes a secondary crime scene. The key features of this may contain transferred evidences. During the process of transportation, some of the evidences from the source to this place might have been Or during the process also some evidences, like for example some tire marks, shoe prints. So these are all some of the points which will lead you to a secondary crime scene. This is often discovered later. Immediately you can't come to a conclusion, so it really requires lots of investigation. Supports reconstruction of events. So with this process you can understand how this transportation had happened, how the secondary crime scene is involved in the crime. You can recreate the crime scene. For example, place where a body is dumped, vehicle used to transport the victim, so hospital where the victim arrives. So these are all secondary crime scenes. Nurse's relevance to this particular event is hospital becomes a secondary crime scene. So if some injury happened, if they are brought to the hospital, then hospital becomes the secondary scene. So nurses must understand you have to preserve the clothing, collect trace evidences, document condition on arrival. So these are all some points to note for nurses. An indoor crime scene. This means a crime scene inside an enclosed space like house, hospital, office, wherever it may be. Key features include evidence is protected from weather because there is no weather contamination in it. So evidence preservation or protection is possible in this. If it is an outside environment, so that there are chances for air and rain to wash out the evidences. So this is more stable and preserved, easier to reconstruct the events because it is a closed boundary. Example like domestic violence in a house, poisoning in a hospital room. So these are all some of the examples. So some points for nurses in this is injury patterns often correlate with environmental objects. So if somebody is coming with some sharp injuries, you can relate that injury with the weapon you find in a crime scene. So it is important to note furniture related injuries like hit, fall. So some furniture hit on some furnitures that will create some injury. So you can correlate with this. Then it is confined with space trauma. So there's limited space only so that you can understand. So these are all some of the points to note for nurses. Outdoor crime scene is a crime scene in an open environment exposed to external elements. Features here are evidences are easily destroyed or altered because multiple people walk through it. There are chances for contamination, or purposefully people can change or alter the evidences also. And this is mostly affected by weather, animals, and human activity. Examples like road traffic accidents, intentional accidents. So it is very difficult to find some evidences in these conditions. Bodies found in field or forest, unattended dead bodies. Nurse's relevance here is evidence may be incomplete or degraded, but still you will have to collect as much as possible evidences. Must be extra careful to preserve remaining trace evidence. At least whatever you are getting, that must be a quality evidence, and document thoroughly. So these are some of the factors of crime scenes. Next is some principles you should understand when you are working in crime scene. The core principle you should understand is Locard's exchange principle. I do not know whether you learned this in previous classes or not. This is a very important principle in forensic nursing. Locard's exchange principle. Locard is the scientist who only brought this idea. Every contact leaves trace. If there is a criminal activity, there is a contact between persons or between person and some environment. So this interaction leaves some traces. What is on me will be on the opponent. What is on the opponent will be on me. So this is what the principle is. If you really look into it, you will find. So that is why there is a saying, any brilliant criminal will leave some trace. So as an investigator, it is our duty to find that. Once if you find and got it, then the case is simply solved. And preservation over curiosity, you should understand. See, if any event had happened, naturally a human being will have a tendency or curiosity to understand how it has happened. So in this process of curiosity, you should not lose any evidence. So that you should be careful in preserving the evidence. Maintain integrity of the evidence. Whatever you have collected, that integrity must be maintained, and chain of custody and minimal handling. So these are all some of the principles you should understand in handling crime scenes. And what are all the principles for nurses when you are in crime scene? First is safety first. Ensure your personal safety. This is what we teach in disasters and emergency nursing too. You must be safe, only then you can help others too. So ensure personal safety, wear PPEs if necessary. So this is important. Then protect the patient and others. There may be some survivors, somebody is struggling for life. So you will have to protect them also. This is the first principle. Then comes your preservation over curiosity. Do not touch anything unnecessarily with your bare hand. Avoid cleaning or altering the evidences. So you must be cautiously dealing with the evidences. Then minimal handling. Handle only when required for cap. Otherwise, avoid unnecessarily handling of instruments, objects, whatever it may be. And chain of custody. Chain of custody is a big topic. I have some big details on chain of custody in the later slides. You will have to maintain it. Nurses or whoever is handling the evidences are responsible for maintaining chain of custody. And objectivity, very important. There is no assumption in forensic nursing. Everything is objective. If it is present, yes. If it is not, no. So there is nothing between yes and no. Maybe, might be, can be. So these are all not allowed in forensic nursing. So then comes crime scene management. By definition, you can say it as a systematic process of identifying, preserving, collecting, documenting, and maintaining evidence to ensure its admissibility in the legal proceedings. So whatever evidences you are collecting, that must be analyzed. All evidence must go for the forensic lab for analysis, and the reports must be submitted to the court of law. When you submit, that must be admissible. Admissibility of the evidences are called as Daud principle. I did not mention this in the slide. So any evidence which is submitted in the court, there are criteria for each and every evidence that has to fulfill all the criteria. Only then the court will accept the evidence. So it must be admissible. So this is what you will do in crime scene management. So the goals include preserve evidence integrity. So collecting evidence, preserving, analyzing, and submitting is very, very important in crime scene management, so that you will understand the pattern of injury, who had committed it, how did it happen, all these things. Then prevent contamination. So that is another important thing. Assist in crime reconstruction. So most of the crimes reconstruction is possible. After investigation, you will thoroughly understand how did it happen. See, for example, somebody fall from a terrace. It is a high-storied building. So by the way the dead body is found on the floor, you can understand whether the person fell down on his own or somebody pulled. So you must have seen in movies and other series or something. They will do many angles. They will reconstruct the scene and identify whether it is an intentional or unintentional event. Then ensure legal validity. So these are some of the goals of crime scene management. And crime scene team members, if you consider, there will be always police officer, investigating officer and his team. Definitely, there are forensic experts, forensic scientists, medical examiner. Now, the new role which is included is forensic nurse. This is an emerging key role. But I don't know whether you are aware of or not. MSc Forensic Nursing specialty started. People are studying in NFSU, Gandhinagar, Gujarat. So those who have undergone a specialized training and valid license, they can be part of crime scene members. Just some 1 or 2 slides about forensic nursing. What actually it does is, see, forensic nursing has 4 major concepts in it. Basic nursing knowledge, so knowledge from forensic science, knowledge from criminal justice, and forensic medicine. So these 4 major concepts are included in forensic nursing. So that is how the forensic nursing is definition is given. You leave the first 2 principles. The third one is given by Virginia Lynch, 2004. Application of nursing process to public or legal proceedings and the application of forensic healthcare in the scientific investigation of trauma or death related to abuse, violence, criminal activity, liability, and accidents. So nurses have a role to play in all these cases. Virginia Lynch is a founder of forensic nursing all over world. So still she is alive. She had developed theory of forensic nursing. So in the US, it is well developed, established specialty. There are practicing forensic nurses. There are practicing sexual assault nurse examiners. India is just started our entry into forensic nursing. Soon we will also have many programs. So involving nurses in forensics is of great help. So we can do wonders in this. That is why the role of nurses in forensic cases are very, very important. So with this knowledge, we can be really beneficial to the community, and we can help in getting justice too. So if you look at the pattern of crime, the incidence and prevalence of crime rates are highly increasing. So we are living in that type of society now. So role of nurses in forensic cases are highly, highly essential and important. So let us come to the point, role of nurse at crime scene. So the primary role is a first responder role, ensure life saving, because that is our priority and we are meant for that, to save life, whether it is a victim or accused, whomever it may be. Now, actually, one more point I will let you know. Now the word victim is not allowed. We call them as survivors. So this is how the terminology change is happening now. So whomever it may be, we have to ensure their life is safe. So for that, we do our work, avoid unnecessary disturbances, use gloves and PPE, whatever it may be. So this is our medical role in a crime scene. Then comes the observer role. So you will have to look at injuries, see how the injury had happened to the individual, what type of injury it is, what is the pattern of injury, what is the seriousness of this injury, how did it happen, who might have done it. So with this curiosity, you will have to look into things, how the patient behaviors. See, for example, in cases of domestic violence or abuse, child abuse or elderly abuse, if they are really sick, they will be brought to the hospital. When they come to hospital, you can see how they are brought. After the incident happened, how much time they have taken to bring that victim to hospital. See, if they come immediately, it may be an accident. If there is some time gap, so that irrational time gap, for example, some fire accident happened, some burns happen at home, morning by 6 o'clock, the patient is brought to the hospital evening 6, means there is something suspicious in it. So these are all you will have to observe. Then who is bringing? If it has happened at home, someone close relative who is living in the family will bring. If some neighbor or some unknown person is bringing them to the hospital, again there is a suspect in it. So you will have to look out each and every behavior and you will have to record it. How the patient is brought to the healthcare facility, who had accompanied, what mode of transportation they have used. So these are all you will have to think. So these may look very simple, but definitely has a major forensic clues on it. Then environmental clues. So by the time when they come, what are all the environmental factors influencing this? So as an observer, you will have to observe all these things. And when you look at the, do a physical assessment and see if the person has injuries, multiple injuries, a different pattern of injuries, wounds of different varying degrees of healing. So these are all indicate that they are undergoing continuous abuse. You won't give your judgment. So this is an abuse case. This is a violent case like this. No, you will really write or describe or document whatever you have observed. There are wounds like this, injuries of like this, the contusion, laceration, bruises, like this only you will have to write it. Then protector of evidence is another role. So we take care of life, we observe what had happened, then find or collect evidences, prevent it from contamination, isolate the patient belongingness, avoid cleaning wounds unnecessarily. Only when it is essential, only you will have to do it. And clinical forensic responsibilities. So here comes the injury assessment. I said type of injury, abrasion, laceration, contusion. So whatever the terminology to be used for that injury, you will have to. So you must be well versed or expert in observing injuries, and you should have a thorough knowledge on types of injuries and causes of injuries, how the wound healing happens, and you must be very much skilled in day wise. If it is a fresh wound, how it looks. If it is partially healed, how it is. If it is completely healed, how it is. So all these things you must be very much thorough knowledge on. Pattern recognition. So weapons related to injuries. If it is a sharp injury, blunt injury, gunshot injury. So all these things have a different pattern. So you must be able to identify and differentiate it. Then evidence awareness, like blood stains. Do you find any blood stains? Is there any hair, fiber, or foreign material on the patient? If not, belongs to the patient. So you will have to collect and preserve it. So these are all some of the roles of a nurse in crime scene. Expanded roles include caregiver role, prioritize life-saving measures, evidence protector role, prevent loss and contamination, observer role, documenter. So because all these documents has legal importance and legal values, everything will go to the court during the jurisdiction processes. So you must be very carefully maintaining the records. An expert witness. Sometimes, if needed, you may be called to the court. You can give your testimony also. So nurses and medical doctors' testimonies are accepted in the court of law. So then, because the main role of a nurse in a crime scene is collecting and preserving evidences. So we will see in detail about the evidence in crime scene. Types of evidence encountered in a crime scene. It may be a biological evidence like blood, semen, saliva, urine. All these biological things are evidences. Trace evidences like hair, fiber, soil, glass, some fingerprints. So these are all you can't see in your naked eye, but these are also evidences. Physical evidences like clothes, weapons, some foreign objects, you can. Pattern evidence like bite marks, bruise patterns, burn marks, shoe prints, tire marks. So these are all pattern evidences. So you must be able to understand it, identify it, and how to take evidences or samples from these patterns. So that also you should. Preservation techniques are important. So you collect, but if you don't preserve it properly, then there is no meaning in collecting. You have to always use paper bags, not plastic items, because that may react with the samples and that may contaminate the samples. So always use paper bags for biological samples. Air dry it. If it is wet, you will have to air dry and pack. So if you pack the wet sample, then there will be fungus growth and it is of no use. And every sample to be corrected, labeling correctly. What is the name of the sample you have collected, date and time, who had collected. So this must be there in the samples. For example, in sexual assault examination, there is an evidence collection kit. I do not know whether I could have put that here. So that saves time. So you won't miss any evidence also. So there is a what to say. It's systematically prepared. How will you collect the evidences? How will you pack, preserve? How will you move it for forensic examinations? So like this, there are many kits available. Even in crime scene also, there may be kits, how to collect samples. You will have to, because you will have to take all these things when you go to a crime scene. So you should know the techniques to collect. For example, trace evidences, fingerprints and all, there are techniques. Forensic experts will know how to trace the fingerprints and collect evidences from it. So this is how you should understand. There are preservation techniques. Whatever you collect, that must be preserved in an appropriate manner. Then comes this chain of custody. So this is a very lengthy topic, but still you should understand what is chain of custody. This is very, very important in forensic practice, because the evidence is collected from one place. Someone collects, hand over it to somebody for analysis, and that goes to forensic lab for analysis. They will do an analysis. Then that will again go to the investigation team. Again, team will do an analysis. Again, that will be submitted in the court, because one sample which is collected will go to many people. So as you see in this picture. So that is why you will have to maintain a chain of custody. At any point of time, we know that at which place the evidence is, for what purpose it is this, before going here where it was, so that you can assess any loop. From the start till the end, there is a connection. That is how the evidences move. That is what is chain of custody is. It's a lifeline of legal evidence. By definition, it is the chronological documentation showing the seizure, custody, control, transfer, analysis, and deposition of evidence. So this is what the definition of chain of custody is. Why it matters is it ensures integrity and admissibility in the court. Because at any point, if the custody is not maintained properly, there are always chances for sample contamination, sample alteration. Then this will be not proved in the court of law. So chain of custody or evidence, it is a continuous succession of persons responsible for the evidence with the purpose to ensure there is neither alteration nor loss of evidence. So that is what chain of custody ensures, that it is the process is done in a transparent and a systematic way. There is no alteration happened during this process. So the purpose is ensuring evidence integrity and legal requirements. By doing this, by maintaining a clear and secure chain of custody, it is crucial for preserving the integrity of evidence, ensuring it remains untampered and reliable for legal proceedings. So legal requirements, various laws and regulations dictate the procedure for chain of custody that emphasizes the need for strict adherence to avoid evidence being deemed inadmissible in the court. So all our efforts will go waste if it is not done properly. The documentation of chain of custody is a record of time, place, and persons who have been responsible for the evidences. The transfers should be kept to a minimum. When the transfers are made, they should be documented carefully. Minimum transportation only you must be using it. All transfers of custody of evidence must be logged with the name of a person transferring the custody, name of the person receiving the custody. So that is why you are able to maintain this chain. One is linked with the other. The documentation may be attached to the evidence. So how to apply the chain of custody? Sample collection, personal and security, storage and use of samples. In these things, you can discuss it. Collection of samples. So when you collect a sample, written consent from a donor is necessary. Even if you collect history, do physical examination, informed written consent is very much important in forensic cases. Without their consent, you can't do any sample collection. Identify the person, type of sample to be collected. The problems arise from storage, transfer, and standards used to test. So whatever samples you collect, you should understand what are all the possible ways this can get damaged and how to prevent it. There is a chain of custody sheet or form. So that will contain sample ID, date and time, preservation, analysis required, name of the collector. So each time when this procession is transferred, all these details to be filled. So there will be a chain of custody format. So that you have to use it. If you accompany any toxicology request, you may have to write it in that form. What suspected agent it is, what is the suspected dose, time of ingestion and sampling. See, for example, if you are sending any gastric content or blood for toxicology sampling, you must give some orientation or intro of the sample which you are sending so that it will be helpful in analysis process. So all chain of custody, sealed evidences indicating patient's name, description of it, source of the material. So it must be completely sealed. Only then you will have to hand over to the next person. What are all the challenges in maintaining chain of custody? There is always risk of contamination or loss. So you must be prepared for it, following the procedure in a proper way. Inadequate training among healthcare professionals. If you are not thorough of what you are supposed to use, so if you are not trained properly, you will not handle it. So enough and adequate training of health professionals are important. Legal implications of a broken chain. So if any damage happened in this process, whomever involved are responsible for it. So it is very difficult to face those challenges. And ethical dilemmas in forensic nursing. So in general, in nursing practice, you will come across with lots of ethical dilemmas. Similarly, in forensic nursing also, you will come across many ethical issues. See, for example, some blood sample is required from the patient. Patient is not willing to give you samples. But if they give only, then they will get justice. So there are there may be situations arising like this. So what is the role of nurse in chain of custody, maintaining chain of custody? Follow proper evidence collection techniques. For example, physical evidences, how to collect, trace evidence, how to collect. So you should understand the techniques. See, if there is a dried blood in a floor, you are just going, you have to take samples from that. You should know whose blood it is. So this will be helpful in doing a DNA analysis. If it is dry, it is difficult to take smears from it. So that you can wet with sterile water and you can wet it and take it. So there are many procedures in forensic nursing, taking or collecting samples. So you will have to follow it properly. So you should have good skills in documentation. Very, very important, with legal knowledge. So however you document, that matters a lot. Collaboration with law enforcement and legal teams. Again, it is a multiple teamwork and you should be maintaining a good professional relationship with all team members. And use of technology, you can use barcoding, digital tracking. So there are many latest technology also had come in forensic evidence collection, tracing and chain of custody. So digital AI has come in many areas. So these are all the latest advancements. So in the courtroom, justice is only as strong as the evidence behind it. If the evidence is very strong, justice also will be very strong. And that evidence is only as reliable as the hands that handled it. So by ensuring justice, forensic nurses don't just heal bodies, they heal the societies also. You must have seen in many movies, see any criminal movies and courtroom scenes, if you see, evidence only speaks. So it is the duty of every nurse to make sure that the evidences are properly collected and analyzed and submitted in an advisable way. So again, remember, there is something is always left behind. So no criminal is that much intelligent to do without any trace. There is something to find. Nurses are the bridge between care and justice. Their meticulous attention to detail in forensic evidence collection ensures that every wound tells the truth. So you must have a thorough knowledge on collecting evidence, processing it, submission. So what are the nursing actions in crime scene management? You mean actually, so we have already told life-saving and forensic awareness, like assessing patient condition, patient emotional status, spontaneous statements. You will have to see, for example, a victim says, he hit me with a rod. Exactly, you have to write verbatims. So this is how the documentation must be. Other physical evidences you will look at in the crime scene: trace evidence, transient evidence, conditional evidence, indirect evidence, circumstantial evidence, individual evidence, and class evidences. So there are so many classification of evidences you will find in a crime scene. See, trace evidences include something like biological, fingerprints, DNA, blood, physical evidences like paint fragments, glass pieces, cloth fibers, some natural evidences like pollen grains, leaf, soil, seeds, insects, larvae, forensic, what is that? I don't get the word for study of insects and insects. That is all another branch of forensic science. See, if you find some
Entomology.
entomology. Thank you. Thought block. Forensic entomology is another important specialty. See, for example, if you find some odd element in a crime scene, means this pollen grain, seeds, or some insects which are of not that particular region, if you find something, that becomes an evidence, so that you can relate this scene with the place where this comes from. Drawbacks include these trace evidences are easily transferable to another place by the perpetrator or by the public intruders. So they are difficult to identify because of their micro sizes. They can be easily destructed due to carelessness. And if you look at transient evidence, evidence that can be washed away, damaged, lost or destroyed either intentionally or accidentally by an environmental factor is designated as transient evidence, like perfumes, smoke, their body temperature, footprints in stand, teeth marks. So these are all, there are possibilities of destroying. So this, again, these are all called as transient evidence. Conditional evidences are, it is a specific action, must be observed and recorded. Like example, windows closed or not, position of the furniture, dead body position. So these are all conditional evidences. At the time when you get into, you will observe and record this documents, because after some time there may be chances of moving and transferring. Circumstantial evidences is a fact that can be used to infer another fact, otherwise called as indirect evidence. Like probability statistics plays a major role here. For example, that a suspect is seen running away from a murder scene with a weapon in hand. Circumstantial evidence. He may committed, may not committed, but somebody running from this place. Maybe that person who came to that place accidentally saw the incident and got scared and run away. At that time, somebody had seen it. So there are possibilities for it. So circumstantial evidences are probable evidences. Class evidences, that blood, hair, which can make a general class. That means with DNA analysis, you can identify this person only had committed. So that's called as class evidence. Another important aspect in crime scene is photo and video documentation. Forensic photography is another subspecialty under forensic science. Nurses must have a knowledge on this also. So as I said, there are many evidences. Detailed description is very difficult in that typical golden time. So that you can do a photography, videography. So that takes all the evidences. It is in our document. So that it saves times and you get a proper evidence also. So photography is derived from the Greek word. Photos means light and graphos means drawings. I'm not giving this definition of photography. You all know it. So what is forensic photography? It is referred as forensic imaging of crime scene photography. This is an art of producing an accurate reproduction of a crime scene or an accident scene using photography for the benefit of court to aid in assessment. Because photographies are accepted by the court of law. It is part of evidence collection. It provides investigator with photos of victims, places, and items involved in the crime. Because immediately if you take a photo, after that if somebody alters, you can identify it very easily because you have an evidence in hand. So there is a history how this has forensic photography had come in. Camera, lens, film, flash equipments. See, there is one quote here. There is a saying here, a tradesman is only as good as the tools he uses. The photography is acceptable only if you use a proper camera. Without that, if you take a dull or not good photographs, and that is of no use. So photographic the crime scene. What are all the basic reasons? To record the scene and associated areas so that it is a document. To record the appearance of physical evidence as first encountered, because after some time during the investigation process, natural decaying of the evidences will happen. So that to avoid that, you always have a first evidence document. Just a minute, please. Hello. சொல்லுங்க சார். குட் மார்னிங் சார். இன்னும் கொடுக்கலைங்க சார். தெரியலைங்க சார். சார் வந்து அனுப்புறேன்னு சொன்னாரு, இது வரைக்கும் அனுப்பலைங்க. இல்ல இங்க இருக்கு, நம்ம ஜிஎம் இருக்குங்க சார். ஆமா தெரியலைங்க சார். அப்படியா, அவருக்கு தான் தெரியும் டீட்டெயில்ஸ். சரி சரி, வெயிட் பண்ணுங்க, கூப்பிடும்போது நான் பண்ணிடுறேங்க சார். அது கன்ஃபார்ம் ஆயிடுச்சு 28ஆம் தேதி. சார் வந்து என்ன சொன்னாங்கன்னா, நீங்க இப்ப ஜிசி பிளான் பண்ணிட்டீங்க, பண்ணிடுங்க. இந்த தடவை உங்களுக்கு ஜிசி முடியட்டும், அடுத்த தடவையில இருந்து குவார்டர்லி மீட்டிங் கரெக்டா வச்சுக்கலாம் அப்படின்னு சொன்னாரு. சரிங்க சார். ஆன்லைன் செஷன்ல இருக்கேங்க சார். Okay. Sorry. And to provide investigators with a photographic record of the scene to assist with their investigations. Because if you look at the initial photograph, you will get an idea how to proceed with the investigations. And to present the crime scene at court for the identification of judges, injuries, and other things, counseling as like. So, admissibility of photographic evidences. Object pictured must be material or relevant to the point of issue. So, whatever photography you are submitting, that must be relevant to the case. Photograph must not appeal to the emotions. So, there is no role of subjective feelings. Photograph must be free from distortion or represent the scene. See, like filters, some makeups are not allowed. As it is, it has to be taken and submitted. That's it. To make it very simple. The images must be clear and usually have scales. See, for example, if you take a photography of injuries, it is better if you keep a scale because sometimes photo may look big, small. So that is why you will always have a scale to understand the size of the injuries or size of whatever you submit. They serve to not only remind investigators the scene, but also to provide tangible image to the court to better enable them to understand what really happened. And use of several views taken from different angles also helps. Instead of taking only one, you can have one object taken in different angles. See, you can take a big photograph, a wide angle photograph which covers everything. Then small photographs of that, or mid-range photographs or close-up photographs. So like the first is a big photograph. It covers the entire scene. It's a big building. There is some fire. So this is one. Mid-range photographs include, so there is an event happened inside the room, confined room. So this is mid-range photograph. Then aerial photography. See, sometimes it is very difficult to catch all informations in one frame. So that is why aerial or drone photography, nowadays it is possible. We can take that. So this is how the aerial photographies can be taken. And surveillance photography, all are aware of CCTV cameras. So when that is fit, it continuously monitors whatever is happening. So you must understand the rule of thirds. Say first photo must be taken 6 feet away. Second photo 4 feet away. Third photo 2 feet away. So that you are looking into an object far, middle and close. So one object should have these three must then from different angles so that it gives a clear understanding of a person who is receiving it. This is called as serial photographs. For example, wound healing patterns. How the wound was on day 0, 17, 25, and 12. So like this, it is called as serial photography. So this also can be used. Then videography. So videography is better preferred over photography. This presents the scene differently than earlier sketching. Before photography, there was sketching. So now, after that, that was altered into photography. Now it is videography. So this gives a better feel. It really gives an atmosphere where you are particularly staying in that place. And this is more intuitive way to see things in this world. So equipment needed, whatever equipment's required. So reasons why video is needed means this gives a walkthrough feeling. So as if you are in that particular place and it provides important feel of the scene. And it is closer how we view the world. Sometimes you can go very close and see the photographs also. So it gives immediate understanding how evidence is related to the crimes. So it is also helpful in making a sketch and photographs too. I'll just show you these are all in detail, not required. See, for example, you take this picture, there are points given. 1, 2, 3, 4. So this is an entrance. You are coming here, take both the sides, go to the next spot, take both the sides, zoom. See, there is a knife here, so there is a zoom. So that you are showing there is a weapon here, again move, show the furnitures, they again go to the fourth point. So there is one furniture which is detached. It is not supposed to be aligned with this, that is moved. So there is a point here so that you are showing that. Again come, see there is a hat which is under the shelf. So you are showing it very close, then come, then go, this is an exit, there is one more exit here, means that somebody might have come through this way, gone through this way. So you are showing that, like see there are footwear impressions here, you are showing it, or they might have come this way, there is an impression here only, not in this side. So these are all the minute things which you can capture through videography. It is just an example of how videography helps it. I just keep these things. Audio in video. Don't neglect audio. If there are possibilities of recording with audio, you will have to record with. Audio is as important as the picture. This always, you always use earphones to listen if any audio is there. If there is an ambient sound, sometimes room noise, even if nobody is speaking, but room noise, some external noise, these are all also maybe a clue to give you or find the suspect. Be aware of wind noise or background music. If your video is heavily dependent on dialogue or you are doing interviews, then you will have to use an external mic. Irrelevant audio in a video is removed or filtered. In forensic laboratory, we should not do it. And this also I will skip. So preservation of evidence is after you collect everything, you will have to preserve it. For example, if you're collecting clothing, remove carefully. It is better always if the person can remove on their own, asking them to stand on a white paper and removing will help to collect on the white paper which is spread down. So this is how you, especially in sexual assault cases, we do the cloth collections like this. Air dry, place it in a paper bag, never plastic. Once again, I'm repeating it. Then body evidences. Avoid washing unless essential, especially in sexual assault cases. Once washed, all evidences will go away. Cover the wounds with sterile dressings. Hands. Use paper bags to preserve trace evidences. So like if any trace evidence are there, again that is to be collected in a paper bag. Then comes the documentation. So after you collect the evidences, documentation is very, very important. As you all know, the principles of documentation, it must be accurate, objective, timely, legible. You will have to strictly follow the principles of documentation. What will you document? Patient statements, verbatims, as it is. Whatever they say, you will have to write as it is. Injury descriptions. If you find any injuries, head to foot, look at the injuries and find. See, for example, if the person has multiple injuries, it will be very difficult to describe every injury. So you can use ready-made body maps. So you can locate 1, 2, 3, 4 like this and you can mark whatever it may be. Then time of arrival, intervention stand. So these are all some of the points to be noted in the document. And photography, if you did, you will have to take consent. So if you want to take photography also, again, you have to take consent. Is especially injury, individual photos. So if persons are involved, consent is very, very important. Use scalar markers and capture multiple angles. So this is some of the points which you must note when documenting the findings. Next comes the legal and ethical issues in crime scene management. So crime scene management is not only a scientific process, but also a legal and ethical responsibility. Every action taken at the scene can directly influence admissibility of the evidence in court, rights of victims and suspects, integrity of the investigation. So forensic nurses maintain legal and ethical standards to ensure justice, patient dignity, and professional accountability. So I know now India has replaced the old criminal laws with Bharatiya Nyaya Sanhita BNS, that is substantive criminal law, BNSS, that is criminal procedure, and BSA, that is law of evidence. Before that, it was IPC, CRPC, and Indian Evidence Act. IPC is changed to BNS. CRPC is changed into BNSS. Indian Evidence Act is changed as BSA. So whatever regulations given under these guidelines, we will have to follow during the crime scene management. What are all the ethical issues and challenges we will face in crime scene? Again, autonomy. So every patient has the right to decide to take treatment or withdraw treatment, neglect. So all these things, patient's rights. Here, even if the patient is not willing, also if somebody is in a critical position, we will have to give. So you will have to use the autonomy. Confidentiality. Again, see, there are many critical, vulnerable, sensitive informations in crime scene managements. But still, you will have to mandate reporting is there. Sometimes it is mandatory that you will have to report it to somebody. It doesn't mean that whatever information you have collected, you will keep it confidential. So this is again an issue. And non-maleficence, patients sometimes will not be willing for it. Sometimes it may be very difficult to handle. So these are all some of the ethical principles you will. Common challenges, patient refusal, emotional distress. You will have to deal with lots of emotions. Post-traumatic stress disorders are very, very common. And that is why there is a specialized approach called trauma-informed care. So forensic nurses must be expert in providing trauma-informed care. Lack of training is another challenge because we have just started. Many are even not aware of conflict with law enforcement agencies. Some special situations like sexual assault, child abuse, domestic violence, very sensitive to handle. Definitely nurses require specialized training and specialized knowledge in handling these victims. So treat the patient, but think like an investigator. So we will always should have an investigative mind. See, this is another example which is given here. Just a diagram for you to. There is some dead body here. Some points are here, 1, 2, 3, 4. So if you look at point number 1, there is a weapon. That means bloody knife near the victim's head. So this is how you will have to mark it. At point number 2, you see some paper, something which is written on it. A torn note with illegible writing found near the body. So this is how you will have to document it. And third one, some blood splash you see. Pool of blood near the victim's leg. And fourth point you see, there is some footprint with some blood near the victim. So this is how you should observe when you are looking into a crime scene. So you should not leave any minute information also. So a crime scene never lies, only the interpretation can. The crime scene is true. It is evident. It has lots of information. If that is failed, so that means the interpretation fails. It is not a failure of a crime scene. So in forensic care, your hands don't just heal, they reveal the truth. So to conclude, I will use this word seeing for principles. Secure the area, control contamination, evaluate systematically, note and document everything, ensure the chain of custody. So by doing this, nurses can very well manage the crime scene. I will just tell you about this academy, Indo-Pacific Academy of Forensic Nursing Science, that is called as INFOFNUS, the only forensic nursing association in India. It covers the Indo-Pacific area. I do not know whether you know about Dr. Goria sir. He is the president of the INFOFNUS and he is the founder of forensic nursing in India. So he had established this organization in 2009. Virginia Lynch, the founder of forensic nursing, came here and she is also a member. She is a patron of this organization. Right now, I am the treasurer of INFOFNUS. We are doing many programs under INFOFNUS. Right now, we have 350 life members plus 300 student members all over the world. We have conducted 11 conferences worldwide. Means every year we conduct an international conference on forensic nursing. Last year, it happened in Bali. So we all had been there and we did many forensic lectures there. We also have a journal, International Journal of Ethics, Trauma and Victimology. So this association has a journal also. This is a journal. Journal was launched in 2015. We have 22 issues published. It is an indexed journal, peer reviewed. And the publication is at free of cost. There is no charges, no article processing charges. So if anybody is interested to become a member in forensic nursing, you can take the memberships, you can visit. There are membership forms available. We do multiple programs. We are also conducting a certificate course, 3 months basics of fundamentals of forensic nursing certificate course, and we do a number of lectures, and we also do hands-on practices for forensic nursing. We have conducted various workshops on pattern identification, documentation, sexual assault examination. So we are doing multiple research projects also. We are doing many pan-India research projects also. So by doing all these measures, we just promote forensic nursing among the faculty and students now. This is for your information. These are some of my references. And thank you. Thanks for patient listening. Hope I am able to give you some information on crime scene. If anybody has any question, I'm really open